welcome to today's Way Forward Workshop Leader Lunch Break. We are pleased to welcome Dr. David Margolius. He has been hailed as an accomplished clinician, researcher, and instructor by Mayor Bibb, and Dr. David Margolius answered the mayor's call to serve and accepted the position of Director of Public Health for the City of Cleveland in June. This weighty responsibility comes after serving as Director of Internal Medicine at Metro Health and the Medical Director of Systems Improvement, where he oversaw, among other things, the patient experience and patient safety. In addition, he has spent years studying the impact of social determinants of health on Cleveland's communities. He serves on the faculty for the School of Medicine at Case Western Reserve University and Harvard Medical School's Center for Primary Care. And if you think that's not enough, he's been busy writing too. He's widely published in peer-reviewed journals on public health topics, including the COVID-19 response in underserved communities, the opioid crisis, hypertension in low-income population, and best practices in primary care. Upon his appointment, letters to the editor in Cleveland.com proclaimed, "Cheers to Mayor Bibb for the appointment." Dr. Margolius will take his bold approach to a broader audience. He has publicly stated in his new role he wants to promote equity and funnel investment into communities oppressed through systemic racism. A proud alum of Cleveland Bridge Builders, he has only been back in Cleveland for 7 years. We can only imagine what more you will do. Dr. Margolius.
Thank you. Thank you so much for that introduction, and thanks so much for inviting me. And thanks everybody for signing up for this session. I have signed up for like 3 or 4 of the lunch sessions, and then something always comes up, and I have yet to actually be present for one. So I know what it means to commit in the middle of the day for something like this, and so grateful that for many of you that nothing has come up that's an emergency that took you away, or if it has, that you're able to do both at once, which none of you would ever do, but know that it's okay. So I for my 10 to 15 minutes with you for my talking portion, I figured I would just kind of run through a little bit about me, a little bit about the health department, our vision for the health department, and all the opportunities to make an impact on health in the city of Cleveland, if that sounds okay to the group. Great, all right. So I was born in Cleveland, born at the Mount Sinai Hospital. Hello, Rachel. Go Mount Sinai, but before it was bulldozed. And I grew up in Shaker Heights. I think I'm a 7th generation Clevelander is what we've figured out. I went to Brown University for undergrad and med school. During med school, I took some time off to do primary care health policy research, and met up with some folks in San Francisco to do that work. Just kind of cold emailed them and said, "Hey, can I, I'm really interested in this topic. Can I come work with you for a year or more?" And they said yes. So, chase your dreams out there. So I moved to San Francisco, stayed out there for 7 years, did my residency training in internal medicine for underserved populations, did a chief resident year there in patient safety and quality improvement. And then when it was time to really live somewhere, I met my wife out there. She was 8 months pregnant. We knew we had to get out of San Francisco because the city had changed, I'm sure changed a lot before I got there, definitely was changing a lot while we were there, to the point that our studio apartment, when we moved out, the rent got listed at $3,400 a month for this like 1-room apartment. So like that was the situation there. So we knew we needed to leave. I thought it would be cool to live in like Austin, Texas, or Denver or Portland, but my wife, who is not from Cleveland, her exposure to Cleveland had been like Thanksgiving visits, said, we really ought to move to Cleveland, Ohio. That is the best place of anywhere we've ever been. That's the best place to raise a family. It's the best place to just be. And she said, "I think you can make a difference there. I don't think you can make a difference in San Francisco, but I think you can make a difference in Cleveland." So we I went on the internet and Googled which hospital was the safety net system in Cleveland, because that's the only place I would want to work. And Metro Health popped up. It was the first hit. And so I applied for a job with Metro Health and I got the job. They paid the same salary as I would have gotten in San Francisco, by the way, just in case anybody's considering that transition. Started at the Broadway clinic in the Slavic Village, Broadway neighborhood as a primary care physician, pretty much full-time, worked on the side with Better Health Partnership, if any of you know that organization. And over my 7-year career there, got opportunities to take on additional leadership roles. And so when I left division director for internal medicine, was the interim medical director for the primary care service line, which included our 21 primary care sites, dentistry, and our urgent care sites. And it was just anywhere where folks would let me in the door, I was involved in. And so I did a lot during the COVID response, and loved my time at Metro Health. Loved my primary care patients. Never had thought about leaving at all. But then this job for the city of Cleveland got posted, and a few friends and mentors kind of nudged me to take a look at it. And I told them in the first interview, I said, well, you're my second choice. I'm applying for another job at Metro. And I'm going in all these details because I know there's a big Metro audience here. So, but then, as I was reflecting more on it, just recognize that for me, if I didn't go for this opportunity, that I would regret it for the rest of my life. And so called, the city back, even though I was still in the middle of this process, and said, all right, everything I said, forget it. Like, this is the only job I've ever wanted. And so please hire me. And, if you make your decision quickly, because I, don't want to leave Metro hanging. So that interview was May 23rd with the mayor, got offered the job the next day, May 24th, and let Metro know, and started August 1st here with the city of Cleveland. And it's been really incredible. There's been a lot written up about the health department over the years. This department has gone through a lot of bad things. And some of which, we were culpable, and other stuff, it was just the greater macro forces at play of taking, funding away and resources. But the people who are here today are an incredible, incredible group of people, and the work they do is really phenomenal. And so our health department, we've got 4 parts. We've got health equity and social justice, environment, and air quality. So air quality is, we are the Ohio EPA for all emissions in Cuyahoga County. So any factory, any scrapyard, anything that's producing pollution, we regulate it in the county. Environment is lead, it is food safety, so restaurant inspections, and it is anything that could be declared a public health nuisance through local health code enforcement. Health is vital statistics, where you get your birth certificates and death certificates. It's our epidemiology department, which we have 5 members. We had 0 in July 2020, like right at the beginning of COVID, because of some other bad things that were happening here. But now we have 5, and they're incredible. We've got clinical staff so that we can do vaccines, like our monkeypox vaccine rollout that's happened over the last few weeks. And then health equity and social justice has a infant mortality reduction program, STI and HIV prevention program, and mental health and addiction program. And so that is the work, kind of the broad view of what our department does at the moment. We have, since my joining, an unofficial kind of vision statement that we put together, which is, we will be the most responsive, most trusted, most impactful health department in the country. Recognizing that this is aspirational, but we truly believe that that's where we're headed: the most responsive, most trusted, most impactful. So most responsive means when you reach out to us as a health department, that we get back to you and we solve the problem. Most trusted means that when you're looking for public health information about the city of Cleveland, you come to us. because we are the most trusted. And the most impactful means that all of the different conditions that plague our city, we are in a position to help make an impact. So what are those conditions of the city? Cleveland has the highest smoking rate in the country. 35% of adults in Cleveland, the last time this was measured well, have used cigarettes in the last 30 days. So we have the highest smoking rate, and cigarettes are the -- 1 preventable killer in the world. Certainly, in the United States, certainly in Cleveland. So, at its height of COVID, 3 times as many people died from cigarettes compared to the COVID-19 virus. The average smoking rate in the country is 12.5%. We're 35%. Cleveland's Black infant mortality rate is 14.6 per 1,000 compared to 2 per 1,000 for our white infant mortality rate across the country. So 7 times as high. Our lead poisoning rate is in 2017 was 12.5%, which is, I think it's twice as high as Flint, Michigan, that got all the press, but I know a lot of folks on the call are working on lead. Our gun violence rate has doubled from 2019 to 2021. So, that is public health. People are dying. People's lives are cut short from gun violence. Traffic fatalities, we lost 74 Cleveland residents to traffic fatalities in 2021. The vision, as some of you have heard, is 0. Opioid overdose deaths, our opioid overdose death rate is 72.5 deaths per 100,000 population, which is twice that of Cuyahoga County and 5 times as high as the country's death rate from opioids. So this is no longer just a rural Ohio problem. And then there's our air pollution, food safety, diabetes, obesity, mental health, maternal health, access to healthcare and access to behavioral health, and in general, access to green space is completely inequitable throughout the city. Access to healthy food and just food in general. So food insecurity is a huge issue, and that all stems from poverty, and that stems from systemic racism. So the list goes on and on, but we think that as the health department for this city, that we can make an impact in many of these areas. We'll have to prioritize on what we take the lead in versus where we're kind of influencing and supporting. But that's the vision, to be the most responsive, most trusted, most impactful health department in the country. So a little bit about monkeypox, because I'm at my last minute, and I know that's on folks' minds. So it took a while to get those vaccines, but we got them, and we're getting them out. And I think folks know at this point, really since the 3rd week of August, that we have a ton of vaccine programs going out through the city and the county. And I see some of the partners on the call today who are helping to administer those vaccines and get them to the right people. So we're doing our best to get the word out, but definitely if folks are in conversations where they're hearing that vaccines aren't available, please let me know, immediately, so we can help correct that, because we've been on the news and we're, doing social media channels and all of the best dating apps to help get the word out to the communities that are most affected by monkeypox. And cases, not really, we can't take credit, but cases have come down quite a bit, and that's really, a lot of advocacy, everybody working together to make that happen across the world and here in Cleveland. So with that, it's 12:15. That's the vision. That's how I got here. And I would love to just, hear from folks on what they think of our health department and where we can, be the most responsive, most trusted, most impactful in the country.
Great, Dave, thank you so much. So with your time at Metro and now into the health department, you really have been at the forefront of talking about COVID and raising awareness. Now, where do we look like now for the city of Cleveland with COVID? What's to come?
Yeah, I didn't even mention COVID, right? So we are looking really good with COVID. I think many things have happened. So step 1 was vaccines. Vaccines have made all the difference in the world. I mean, when we rolled out those vaccines at Metro on Christmas Eve, or maybe December 23rd, almost immediately, the number of positive cases just dropped like off a cliff that we were seeing from employees. The hospitalizations, once we spread the vaccines out in the community to, especially to folks above the age of 60, hospitalizations dropped dramatically. The numbers that we're at today, the cases might be high, they might go up and down. I mean, we're back to medium, and all of you know that we haven't done anything to go from high to medium. It's the variants. They're just going to do what they want. The hospitalizations that we're seeing today are generally folks who are in the hospital for something else, and we test them for COVID because it's what we do for a number of different reasons, and they happen to be positive. So the days of seeing like ICUs full of severe COVID pneumonia, those are thankfully in the past. Unfortunately, what it took to get there was, in addition to the wide-scale vaccine effort, it was Omicron virus. Omicron changed everything. Omicron was so contagious and hit Cleveland before it hit the rest of the country. If folks remember last Christmas. And so because of that, so many folks gained immunity in addition to their vaccine immunity. And so the teeth have kind of come out of COVID for our community. And so what I'm hoping to do is, not to minimize the impact of COVID by any means, but to just steer that same energy that our community has delivered to COVID and take that into all these other areas like lead poisoning, like smoking. Lead poisoning, people are talking about that, but people haven't started talking about smoking yet. So I hope to change that.
And regarding pediatric lead poisoning, are children with high levels being tracked and helped by the city health department?
Yes. So where we help as a health department, Ohio Department of Health sends us a list of children who have been poisoned. We go out and interview their families and visit their homes to figure out what the source was for the lead poisoning. If we deem that the source was their home, now, thanks to all the work that's happening through the Lead Safe Coalition, we are armed with resources to help them through that. Sometimes it's still not enough, but because of all the different macroeconomic things at play and the lack of just safe, affordable housing in general in the city of Cleveland. But we're armed with resources. Our clinical partners take care of those children, and we work on secondary prevention, which is making sure that other people in that same home aren't poisoned. But what we'd like to do, and that's what the Lead Safe Coalition has really led this work in steering the attention to prevention rather than secondary prevention. And we'll keep doing secondary prevention, but we need to get to these homes before we have a situation where kids are poisoned by lead. And so the vision for that is zero as well.
In what ways do you see the Medicaid program in Ohio helping you with your goals? Any specific things you're hoping to partner with MCOs or the state on?
Well, yeah, I think, all hands on deck for all the issues that I've discussed. Certainly, the opportunity from the payers for healthcare are to invest better in primary care and mental health services. And that's not just to change people's salaries, but that's just to, flood resources in that direction. Because, folks know that one night in the ICU delivers a lot more money to our healthcare system, and that's where all those resources are there, so we can save those lives. But if payers can help us invest more money into prevention, to primary care, to mental health services, that would go a long way to all of our healthcare systems being able to invest more resources in those areas.
What would be some of your priorities relative to the integration of health, especially with behavioral health, so we can really move the needle on the ongoing crisis we have related to opioids and mental health in Cleveland?
Well, I'll separate those out because, opioid use disorder, in my mind, is really a physical illness. And for years, it was looped into kind of mental health thing, and mental health, behavioral health is like, I don't know, this isn't necessarily us, but here's the resources that we have to work on this. But the more addiction is seen as a physical illness with a medical treatment, which is Suboxone, opioid use disorder, it just dramatic improvements with a pill. every day that can be prescribed in any clinical setting. Unfortunately, the state makes that a little bit difficult. They set up rules, certain hurdles that folks have to jump through. But the more that we can impact that and help people get access to Suboxone, that's a huge opportunity to make a difference for deaths from opioids, Narcan availability, peer support. I mean, there are all sorts of other resources, and see folks on the call who are experts in those fields. But my hope is to really help project a harm reduction model and help reinforce, that Suboxone is the treatment for addiction for opioid use disorder. As far as behavioral health services, yeah, I mean, just removing barriers, helping with reimbursement, anything we can do to co-locate services so that people aren't waiting 8 months for an appointment with a behavioral health professional.
So you mentioned gun violence as one of our public health concerns. How can your department work to curb gun violence?
Yeah, so the nice thing about what's happening in the city is when the mayor focuses on something, it will improve. The mayor can only focus on so many things at once, and so we're all kind of, always working to get on the agenda of what's being focused on. But gun violence is definitely a top priority for him, and he's done some amazing work and already in violence reduction programs like the Hoops After Dark program in the rec centers that helped give 18 to 24-year-olds something to do where they weren't at risk for gun violence in the same way. So I think we can help to support that through showing up, reminding folks that this is a public health crisis, that this is a public health challenge, and not something that is, simply a law enforcement problem. So that's how we're hoping to support there.
So speaking of the mayor, he began his term with a 100-day plan. If you had time to think about your first 100 days, what goals would you like to achieve?
Well, I'm in day, 40 something, 45 or something like the 46. And when I interviewed for the job, recognizing the history of this department, my goal was to work on the culture of the department. I would say culture and a little bit of reputation management. These folks, when I talked to the commissioners coming into the role, one of them in particular said, it's been a tough few years. And I said, yeah, COVID, that's awful. That as a public health department, that must have been so hard. And she said, no, I'm talking about like all of the leadership transitions and all of the, bad press that we've gotten, and like I said, some of it justified, some of it kind of a bigger problems with lack of investment. But these folks here, the 150 people in this department, have been through a lot. And so focusing on them, elevating the work that they're doing, and that's been my priority in the first 90 days.
So as there has been increased access and emphasis around affordable housing and accessible housing, how do you see that impacting public health in our community?
Yeah, so housing is health. I mean, so many of the things that I discussed, that the challenges that are plaguing our community are related to lack of safe and affordable housing. The fact that people don't have an option but to live in a home full of, lead, chipped everywhere, windowsills and dust around the area. I mean, that's all comes back to safe, affordable housing. So it's when I met with the folks who are leading our ARPA spending plan, they said to me, hey, really sorry, none of the ARPA money is slated to go to public health. And what they meant was like specifically to the public health department in terms of my workforce or, new furniture or whatever. But what I responded was, no, the work that you're doing is public health. I mean, spending $50 million on safe and affordable housing is going to improve the health of our community. And so that's definitely really exciting. And in my role, I think hopefully can continue to advocate for that spending as a public health, through a public health lens.
So much of the work you've already done and will be looking to do requires collaboration and coordination internally across the city, but also with community organizations. How has the process been with building those relationships and building that trust with community partners and within the city?
It's been good. I think it's been good. Yeah. I mean, I am addicted to my email. And so I hopefully for folks, when they reach out to me, they get a response from me pretty quickly. It's getting, harder as in this new role. But yeah, I spent the morning at the Canopy Center. I see Jennifer Johnson on the call. And the Child Advocacy Canopy Center. I hope I got the name right. But there are just so many incredible organizations in our city. And so I, in my role, want to elevate the work that's being done. I don't want to duplicate, the work that you're doing. I want to find those gaps and fill those gaps. What can we uniquely do as a health department? But if you're doing work that's impacting, benefiting the health of Clevelanders, I want to support you. Not necessarily financially, but, with letters.
So we've talked a lot about the health challenges that Cleveland has, but where do you see bright spots in our community around public health?
I see bright spots for the folks who know me, I see bright spots everywhere. I mean, this is this is what, my wife saw 7-8 years ago when we were making this decision to move to Cleveland. The people of Cleveland are incredible. It is an incredible group of people who care, about our city. There's so much pride here and this kind of underdog mentality. So I think what had been missing, frankly, for the last 16 years from the city was leadership on a lot of these issues. But we're here now. And we want to make an impact. We want to support the work that's happening. We want to show up. So yeah, I'm pretty excited about our future.
How do healthcare organizations best partner with the Department of Health beyond what they might already be working on? How can they reach out and support this work?
So I think that I would love to keep steering back to the number one negative risk factors for health in the city of Cleveland. So anything that the healthcare organizations can do to help us reduce our rate of smoking to get us, out of this number one spot. I don't want to be on the top 50 for smoking rate in the city, for across the country. I know there's already work happening with lead poisoning. I know there's work being done with opioids. I think we can do more. If someone can't call your healthcare system and get an appointment to get a prescription for Suboxone within, a week or two, then I think we, can do more. And coming from the system, I know how hard that is. But I just want us to keep pushing to be able to do more to make a difference.
And as you look ahead, what do you most hope to see, say, in the next 5 years for our community in terms of public health? And what additional resources do you need to help get us there?
So I would love for us to have the most dramatic reduction in smoking rate and lead poisoning rate and deaths from opioids, deaths from traffic, deaths from gun violence, and so on and so on. I mean, I think, we might not get to like the number one healthiest city. I recognize that, but I think we can have the most dramatic improvement over the next 5 years.
And how can those of us on the call help you get there?
Oh, thank you. I knew there was a second part. So yeah, I will certainly would love ideas from folks on the call, reach out. But I, looking through the list of organizations represented on the call, I know so many of you are already doing this work. So keep going. Let me know how I can help. And, as much as possible, let's work together instead of competing, to help the same folks.
Well, Dave, we are so happy to have you here with us today and are thankful for your leadership and your vision in the Department of Public Health. As so many of us know, public health has been at the forefront of our lives these past few years, and we are looking forward to what is to come for the city of Cleveland.
Thank you. Thanks for having me. Thanks everybody for being here.
Dave, thank you for sharing your vision. It's truly inspirational, and you have a whole host of supporters on this call to do anything they can to help you advance that vision. So thank you.